So, Maria, I give you back the floor to you.
Great. Thank you very much. And thank you to everyone who stayed online. I'm really hoping that what we're doing here is engaging in a conversation with you about how you may be thinking yourselves about developing or evaluating interventions that you have in place to encourage positive masculinities and gender equality in relation to sexual and reproductive health and rights. And one of you has asked about resources. And I'm very happy to share the PowerPoint slides I have here today with the references to the evaluations of the work that we've done in this area. And our colleagues at UNESCO will share those out with you. And but let me tell you a little bit more about them now. And I suppose I want to start with some 3 take-home messages for those of you who are interested in developing interventions to transform masculinities and sexual and reproductive health and rights, just as has been done in Armenia. And I think 3 key takeaway home messages that I would like to impart in terms of what I think works well is, first of all, co-designing with boys and men, indeed co-designing with youth in general. And this is particularly important because boys and men know that a lot is said about them. They hear about toxic masculinities. They know sometimes that sexual and reproductive health and rights doesn't sit easily for them. It's something to do with girls. So it's really important in any work that we do here to hear about boys and men's own stories in this, to hear about their own hopes, if you like, for positive, intimate sexual relationships, and to know that they're listened to. So, co-design to engage with boys, to hear their stories, to tell their perspectives, to tune into their wavelengths is crucial. And the second C that I'd like to talk about really is about conveying their perspectives and the importance of this. So for us in our interventions, we tend to use drama, short films that are scripted with young boys and men, and for whom we take advice from and how we cast the actors and so on. But as Army has shown, this is also just as well done through comic strips. Or also Army's example showed about the ways in which their stories were conveyed then by wider social influencers through the social media campaign. So it's critically important that these stories are sort of conveyed from boys' perspectives on these issues. So that even actually when programs are being delivered in schools like ours are, or in prisons like ours are, and when they're coming from kind of adult perspectives or being facilitated by adults, that the youth voice and the boys' voices are not lost in these programs. And the third C is about challenging boys and men. And that's where Elena started in her talk today as well. She reminded us again about the ways in which boys and men's actions in today's world, it's true, have very serious repercussions for the ways in which girls and women live, their rights to sexual and reproductive health and rights, whether it's, in terms of very serious violations like sexual violence or gender-based violence, or things that we consider less serious, like, for example, sharing caring work, whether it's household work or caring work for children or elderly parents. It's about challenging men in the ways in which this impacts on women's lives. So these 3 C's, I think, are saying to us that, yes, we need in every intervention to say, yes, come to the table, join in with us, let's hear your voices. But now we're also going to challenge you to think with us about men's behaviours and attitudes which negatively impact sexual and reproductive health and rights. And in the programs we talk about today, commonly we think about doing this with young boys in groups or individuals. But as Didier sort of started off this morning saying, or a little while ago, he said, think about the blocks. Think about the multi-level approaches that we need in order to create change. So it's also thinking about the ways we engage men in thinking about the way health services are structured, access to health services, access to education services, who we elect, um, how we set up our services, including actually as well, access to abortion services. And this challenging piece is about how we do gender transformative work with men and boys. So now I'm going to give you a few examples of how we've applied this in our examples, in our interventions. So the first program I'm going to tell you about is called If I Were Jack. And this is a comprehensive sexuality education program. And it's designed for use in schools in the UK and Ireland, with boys and girls, to speak to that question, aged approximately 14 years of age. But it's designed specifically to engage with boys, because we know that sometimes sex education in schools is gender blind. You know, we assume that boys will engage as much as girls, but actually they don't. And often they don't if they're not expressly brought into the conversation. Now, If I Were Jack isn't the answer to all issues. It specifically looks at unintended pregnancy, in fact. But it does speak to this broader role of promoting positive, consensual, intimate relationships with all sexes and all sexual identities. And I suppose we've been working on this for a while, so we've had now the opportunity to also bring this through to a full randomized controlled trial with over 8,000 pupils in the UK and Ireland. And we've had some very positive results from this trial. And crucially, it's been the first trial of a comprehensive sexuality education program that proved that we could increase safe sex with boys as well as girls, or contraceptive use once boys and girls are sexually active. But it's also had shown positive effects in relation to improving gender equality relationships and intentions to have safe consensual sex, and also in terms of access to just knowledge about sexual health services. So all of those things were proven to be improved in the Jack trial. So I suppose what the Jack trial in essence showed us that if you engage with boys, they will lean in. And so that encouraged us to also go on to design interventions in South Africa and Lesotho, where the need is arguably larger. But again, to go back to this co-design part, we started from scratch almost again, looked at the scripts that we were using in our interactive dramas. I could, pause by saying that I told you that these interventions are drama based. And so in each of these versions, the UK version, the South Africa Lesotho version, and the Uruguay version that we have on the screen here, we co-designed a script with young boys about what it was like to be told your girlfriend is unintentionally pregnant. And the film is an interactive film that tells the story of a week in the life of a young man whose girlfriend is unintentionally pregnant, and how he thinks through these issues. It is interactive in the sense that it stops every couple of moments, and we invite young boys and girls to think about, what would you do if I were Jack? What would you say to your girlfriend? How would your friends react? What would you tell your parents? How would they react? Would you access health services? If so, what would that be like? So we're trying to develop almost stop and think strategies or communication strategies with young boys around these issues, and also helping them think about how they might access support. So when we went on to do a version in South Africa and Lesotho, we didn't simply take the script from UK and Ireland, but stopped again and asked young boys and girls, what's it like in South Africa in this situation? What's real for you? So you could hear it from their voices. And again, the same in Uruguay. So in each of these cases as well, these programs are followed up with classroom-based exercises. And in these classroom-based exercises, we tease out these issues further about, well, how do you access knowledge? What do you know? What do you need to know? Where do you find that information? And not just giving the information, but teaching young people the skills of where to get that information. And that was clear in Army's intervention as well. It wasn't didactic education, it was interactive. We also do classroom activities to challenge stereotypes, challenge harmful masculinities. And we do this with boys and girls talking to each other because sometimes it's that conversation between boys and girls that's really important. And but crucially also, we, as part of this intervention, we reach out to parents and we have classroom activities that go home with the pupils. Sometimes they don't reach the home through the pupils. We recognize this. So the schools also send out text messages with specific videos for the parents. So it begins a kind of what Didier was talking about with some more of the blocks in the wall. But I thought Army's example of having social influencers around the intervention would also enhance this intervention very much. So each time you can learn things from different interventions. This is very much a classroom-based one. So that's the If I Were Jack one. We'll share the references with you. We'll share indeed the materials with you if you're interested in developing interventions like this. And now I just want to share one more example with you before I finish up. This is one called If I Were Dad. And this is the first comprehensive sexuality education program that was developed by young men in custody or in prisons for young men in prisons. And at the start of our seminar as well today, the chair mentioned the importance of lifelong education. And that is particularly important for young men in prison who usually have left school at a very young age and have definitely lost out the opportunities for that sort of communication with parents and with peers at a young age. So on foot of the If I Were Jack work, we were invited into prisons to do a kind of a relationship and sexuality education program with slightly older men, 16 to 24. And lo and behold, of course, we found out that If I Were Jack didn't work. Wrong target audience. Too young, and also they felt that Jack was too foolish. They'd be much more streetwise. They knew what to do. But crucially also, they thought that they wanted to be dads. So wanting to be a dad was the hook that brought them into wanting to know about good relationships, preventing gender-based violence. And that's the message, I suppose, when you co-design with young people. You need to find out what is the hook that's going to bring them in to the conversation. What's going to be the motivation for them to change their lives? And this program followed the kind of themes that Army put up. It talked about, what's it like to be a man? What's it like to be a good man? What's it like to have a good relationship? What does that look like? What does caring for a child in the future look like? And what is good? Well, how do you prevent gender-based violence in your life, for starters? And how do you challenge it in society? So I should stop there. But again, here's a reference to the evaluation of that study that we wrote up about the If I Were Dad project. You're welcome to access it. You'll hear about the rights-based design behind it. And then I'll also leave you with some further references to work that I've mentioned today. The BMJ editorial there gives you a summary of work we've done with WHO in general on challenging harmful masculinities. What are the priorities to look at in relation to men, boys, masculinities, and sexual and reproductive health and rights? The SHRM blog there gives you a nice lay summary of some of the results of Jack trial and so on. So thank you very much. Look forward to the discussion.